Hi everyone. We thought we would take the opportunity of having a discussion with a couple of experts here around coronavirus. We know that it's been something that we're all aware of, that it's preoccupying a lot of people's time, and we just happen to have some of the top authorities in Australia here at Telethon Kids Institute, so we thought we'd take the opportunity of asking them. So here I've got Professor Cheng. Alan is Professor of Infectious Diseases Epidemiology at Monash University, one of Australia's leading authorities on the coronavirus, has really been intimately involved in some of the discussions and planning around it. And of course our own Asha Bowen, infectious disease physician at Perth Children's Hospital, and of course a Wesfarmers Centre for Vaccines and Infectious Diseases researcher here at Telethon Kids Institute, who also heads up the paediatric component of the Australasian Society of Infectious Diseases. And these guys have actually been writing some articles about coronavirus, especially in kids. So what we're going to do is ask Alan some critical questions around coronavirus. So Alan, we're hearing this word pandemic thrown around. Tell us what that means, and should we be worried?
Pandemic has a very specific technical definition. It means uncontrolled spread of infection in multiple regions of the world. But for all intents and purposes, it's not important anymore. All governments in the world are basically treating as if there could be uncontrolled transmission in their own countries, and that's really what matters. Australia declared that a number of weeks ago. Just even before that, the WHO defined this as a public health emergency of international concern. So that's really what matters at the moment.
Okay, so just let me clarify the terminology as well, because we're hearing coronavirus and COVID-19 and the actual virus itself. So tell me, what do these different terms mean?
Yeah, so COVID-19 is the disease. SARS coronavirus 2 is the virus. Everyone gets that mixed up all the time, including me. But the coronavirus is the virus, and SARS coronavirus is one strain of those. There are both endemic human coronaviruses, so there's the ones that cause the common cold, and then in the past there's been obviously this one, there's been the SARS coronavirus in 2002, 2003, and then the MERS coronavirus that started in 2012. Okay,
so tell me what we know about this virus, in particular what research is being done around it.
It's pretty early days at the moment, so very early on it was sequenced, and so that establishes sort of its relationship to other coronaviruses, and has allowed us to make diagnostic tests. So we now have a PCR and diagnostic test for this coronavirus. And in contrast to SARS coronavirus, it took 6 months to develop a PCR, so we're really moving very quickly. There's been a lot of genetic studies, binding studies, for example, receptor binding. So we do know that it binds to the angiotensin converting enzyme 2 receptor, but it's very early days and we're still learning a lot about this.
And why might that be important?
It would be a target for perhaps interventions as treatments, or perhaps something that might be a clue for how a vaccine might work.
Okay. Tell me, we heard very early on about a big breakthrough at the Doherty Institute in Melbourne. What was that?
That was to grow the virus, and they grew it in vero cells, which are sort of commonly used to grow viruses. It wasn't isn't the quickest thing to grow, but they were able to do that. And the significance of that is really that, firstly on a practical basis, it means that you can have control specimens, so a positive sample that you can distribute out to labs to say this is a positive, can your test detect this, because this is the real virus, and so that's also called a positive control. And then obviously it's a potential for researching it. Once you grow it in larger quantities, you can do lots of things that you couldn't do before.
So what other research is happening in Australia on this virus?
There's quite a lot going on at the moment. There's the University of Queensland trying to develop a vaccine, and I understand that they will have a candidate fairly shortly to start testing. It is going to be a long road to a vaccine, but you've got to start somewhere, and they're obviously working very, very hard on that. There's a lot of clinical research going on, trying to collect data on cases and provide surveillance data for public health. There's a lot of modelling going on, so trying to predict the course of this and when we might expect more cases. So there's sort of mathematical modelling of infectious diseases. There are treatment trials that are being developed. There's a very large clinical trial that is run globally that aims to slot in different treatments to see which is the best treatment.
So there are some possible treatments, because we didn't have any for SARS or MERS, did we?
No, we didn't. And I mean, I think it'd still be fair to say that these treatments are a bit speculative. We do need to see if they work. The treatments that have been talked about are lopinavir, which is an HIV medication, and remdesivir, which was an antiviral that was actually developed for Ebola. There have been trials that have actually started, and we understand one of them's almost finished actually in China, because the number of cases has been so high. So we'll really be keen to get those results when they're available.
So let's go back to the vaccine. You said it's going to be a long slog to get a vaccine. How long, and when can we realistically expect one?
It's difficult to say. There are a lot of steps. So even after you get a candidate, you need to test it, perhaps in animals or in humans. You need to make sure that it's safe to use. It doesn't make the disease worse, obviously. And then it needs to go through regulation. You need to be able to make it with good manufacturing practice. You need to get it through the regulators, and then you need to produce it at large scale to deploy it. And then you need to actually have an implementation plan to get it out into the population. And all of those steps, would typically take years. So even accelerating it, I would be surprised if we have anything that might be commercially available for 12 to 18 months at the very, very least. And that's if everything goes very, very well.
And the experience again with SARS and MERS was that the disease just went away. So can we expect that this vaccine will actually be useful?
It will be difficult to know. There are a lot of wildcards in terms of their epidemiology. So there are a lot of things we don't know, and it's certainly not behaving like SARS or MERS, so I don't think it's going to go away. But China and Singapore and Hong Kong have done very well with control. We have summer coming up in the Northern Hemisphere, and that's a wild card. We don't know if it's going to be seasonal or not. So I think we need to keep working towards a vaccine.
But people shouldn't pin their hope on a vaccine being
not in the near future anyway.
Should we be worried about this virus mutating and becoming even worse?
Yeah, I think that risk is probably a bit overblown. All viruses mutate, and that's a normal part of viral evolution. And not frequently do mutated viruses. They're not always worse. So this virus is pretty good at spreading. It's not likely that mutations will make it any more virulent or any more transmissible.
How good is it at spreading, say, compared to flu?
So it looks a little more transmissible than flu. So I think I've described it as flu on steroids, a little bit more transmissible and a little bit more dangerous. But it has some sort of key differences, and one of the very key differences is that it has quite a long incubation period. So flu has a very, very short incubation period of sort of 1 to 2 days, and this one has, it looks around 7 days. And the significance of that means that you've really got 7 days to find your contacts before they themselves become infectious. And that's actually a pretty key parameter. So that sort of gives us a fighting chance at trying to track down contacts and trace and stop transmission that way.
So in terms of how transmissible it is, could it be that you just walk past someone in the street and you could be infected by them breathing on you or coughing? Yeah,
it's less likely that way. I think most of the transmission does appear to result from close contact, and particularly in households. But there are other situations, in a bus and crowded situations where transmission might occur.
Okay. So we've been told that we should be isolating ourselves if we have symptoms. What does that mean, and how effective is it? Just take me through, if you were told you need to isolate yourself, what would that look like? So just sort of clarify the nomenclature. So isolation is if you're sick, sort of staying away from other people to reduce transmission. And then the other related concept is quarantine, where you're not sick and you're removing yourself in case you do get sick and are potentially infectious. So isolation is basically removing yourself from other people, and we either do that in hospital or at home. In hospital, isolation in our context means that we put you in a single room with a toilet that you use, and the people that will come in will have personal protective equipment and masks and so on.
At home, it means putting yourself in a room and trying not to interact with other people, and you might, anyone that comes to, to help you with food and so on, should wash their hands and pay attention to their personal hygiene. But that sort of measure should be enough to prevent transmission.
But then tell me about the quarantining situation.
So quarantine at the moment is being recommended for return travellers from certain countries, and that list of countries changes every day, so I'm not going to reel them off now. And for people that have come into close contact with a known case without any personal protective equipment or anything like that. And it's for a period of 14 days, because we think that's the incubation period. And basically...
You said 7 days before, but 14 days is the maximum?
Is the maximum incubation period, yeah.
Yep.
So every incubation period has a range, and most of it is between 4 and 10 days, but 14 days allows a little bit of room for uncertainty there.
Yep.
And basically it means just keeping yourself at home, and if you do become unwell, present for testing or call for help.
This is obviously changing day by day.
Yeah,
I mean, you're not a crystal ball gazer, but what's your prediction in terms of how the travel bans, restrictions, advice is likely to change in coming weeks?
Yeah, I think the government has signalled that we can't do this forever. So they are a temporising measure to buy ourselves more time to some degree. I think that certainly in the case of Iran, the risk is really extreme. There's been a number of cases now from what is a small number of travellers from Iran. But in the future, I don't expect that we'll be seeing these going on forever, and with increasing lists of countries that will be on that list.
Okay. Would you consider this to be at the severe end of a kind of viral infection? Is it a particularly nasty one?
Yeah, it's a bit hard to say. I think what everyone is waiting for is serological studies. So the one thing we don't know about this virus is how many people get infected that never show any signs of infection at all. So if that proportion is small, then we're looking at an infection with a proportion of people that die of sort of in the order of 0.5% to 1% of people, and that actually is quite a lot for a respiratory viral infection.
How does that compare to, say, influenza?
So with influenza, for example, swine flu, which did tend to affect younger people, the case fatality ratio, or the proportion of people that go on to die, is probably in the order of 0.01%. Okay. So it's 1 in 10,000 or 1 in 1,000. And so this is sort of an order of magnitude more than that. But it is possible that when they do these serological studies, we may find out that a lot of people have got an asymptomatic infection. That would obviously push down that ratio somewhat. And
we're hearing that the elderly, the infirm are the ones who are really at risk. Of the deaths, how many are actually happening in otherwise healthy younger people?
So most deaths do occur in older people, but we are still seeing a mortality rate in people that are younger. There's sort of very prominent deaths of people in their sort of 20s and 30s. Thankfully not commonly, but it does occur.
I just want to go back to the quarantine for a second. We've seen the pictures of the empty toilet paper aisles.
Yeah.
But I'm just wondering, what should people do right now? Is there any preparation they should be undertaking in case they do need to home quarantine?
I guess there's a number of things that I recommend to patients. The first is that there's a lot of misinformation going around, so to be informed from credible sources, and that's official websites and the Telethon Kids Institute and places like that. The second is that it is probably worth getting a little bit of medication in advance if you're on chronic medication. It's not always possible to do that, but that probably is important. And the third one is really to have an action plan. So if you have an illness yourself, or if you became unwell, what would you do? So you may be asked to be in isolation for 2 weeks. What would you do in that situation? What do you need? You probably need a few toilet rolls, but perhaps not a whole garage full of them. Then what would you do if one of your family or one of your household members became unwell? So if you had a child that became unwell, how would you look after them without infecting yourself? Or if you had a household member, how would you keep them fed without and made sure that they were okay. And then the third one is really about looking after the community. If you have elderly parents or other people that might be vulnerable, how are you going to check in on them and make sure that they're okay as well?
So what can we expect in Australia over the next few months, and I guess how do pandemics end?
There are a number of different scenarios. So what the experience in Singapore and Hong Kong suggests that at the moment they're able to hold the sort of the infection at bay with very intense public health measures, and certainly in China as well, that a lot of the infection rates have been going down. And with this sort of infection, I guess the question is this going to be sort of something that becomes established like influenza? So, we can't probably keep a lot of these public health measures going forever. But how do we best control it in sort of the next phase of this? The other, another scenario is that there is, an increase in number of cases, and South Korea and Italy at the moment are sort of seeing those sort of figures. How do we prepare our health systems to cope with those sorts of numbers? And then in terms of how do pandemics end, it's basically through some sort of immunity. So either you get infected and immune that way, or we have a vaccine and we get immunity through immune protection.
Okay, well, just on the last one to you is, do you have any specific advice for people working here at Telethon Kids Institute, people working here at Perth Children's Hospital? Is there anything particular about being in a place like this that people should take on board?
Yes, I mean, I think this is it's I guess there's two important things. So one is about the employees that work here, and they're members of the community as well. They will be a trusted source of information for their for their friends and relatives. So to make sure that they're informed and get credible information. And then, this is one of the premier medical research places in the country, and I'm sure there will be people that will be working on the epidemiology and vaccine research and so on, and that will be really important in the future.
Is there any particular reason why people here should be extra careful because they happen to be working inside a hospital building?
I don't think, particularly in a children's hospital, I don't think there's going to be increased risk. I think that for people that are directly caring for patients, they will need to be careful with personal protective equipment when they're caring for patients. But I don't have any reason to believe that just by working here that you'd be at any increased risk.
Thanks, Alan. That's fantastic.
No
let's turn to you, Asha. We're obviously focused on happy, healthy kids at Telethon Kids Institute. How is this virus affecting kids?
Well, so far we have some information coming out of China which shows that in the large numbers of adults who've been infected with the virus, there are only small proportions who are children. So does that mean that children have had an asymptomatic infection and developed immunity and didn't get sick, or does it mean that they just weren't exposed? I guess we don't really know as yet. We do know that in all the children who've been reported, so there's about 1,000 children under the age of 18, and about 500 of those were under the age of 10. None of them have had severe illness and none of them have died. So I guess that's quite reassuring. Mm-hmm. What that looks like in, I guess, our context and with our healthcare service and understanding it better, we may have a change to that information, but at the moment that's our best knowledge.
So it's possible that the kids, although they're not getting sick, are actually transmitting the bug to other people?
We wonder whether that could be the case. So children might be able to, say in a flu season, they're definitely seen as being big transmitters of the virus. So it's possible that this is behaving similarly, and for some reason they have some immunity to it, possibly because of other similar viruses that they've had before, which I think is a very hypothetical question at the moment. It's not something we have some evidence for. So why they're not getting sick is really unclear, and whether they can transmit it. There's definitely a few case reports in the literature already of someone who's presumed to be asymptomatic transmitting to other contacts within the household. We still, I think, need more evidence and more time to figure that one out exactly.
Okay, so that's a really important question that I think a lot of people have, which is we say home quarantine if you've been potentially exposed, but as an individual, you want to know, are you at risk of transmitting the bug? What is the evidence that before you even get any symptoms, any fever, any runny nose, that you could potentially transmit it? Or is it really only once you get your first sign of being sick?
I think the honest answer is we don't know for sure. I think that in one of the case reports, it turned out that the person who was claimed to be asymptomatic did have the snuffles. So probably had some level of symptoms before the transmission occurred. There are a few other case reports where it looks as though there were truly asymptomatic people who have been able to transmit the virus. But I guess you wonder about your own experience of a viral infection, and sometimes you play down the symptoms, sometimes you've got something so important on that you disregard the symptoms. And so I guess it's really thinking about how that has been playing out.
Can you tell me what the role of face masks is? We keep seeing people wearing face masks. How important are they?
I think face masks are really important for protecting healthcare workers, because we need our workforce to be available to provide the care that families, the elderly and potentially children will need in hospitals. So I think that you want to make sure that those who are continuously exposed to someone who has the virus have that level of protection. I think that face masks are useful for someone who has got symptoms to try and protect their loved ones and those around them. I think face masks prevent the infected person from potentially transmitting the virus, and it also protects those who are providing care. Whether each of our houses needs to have a face mask, I think probably not. I think that the best advice is around cough etiquette and hand hygiene. So washing your hands with soap and water after all coughs, sneezes, exposures to snot is really critical, and upping our opportunities to remember to wash our hands regularly is probably more important than necessarily thinking about face masks.
And does it have to be with the special stuff that you get for washing your hands?
So whether it's alcohol or whether it's soap and water, I think we all have soap and water in our homes, right, and there's plenty of it at most public places in terms of public bathrooms, and so I think using soap and water is demonstrated to kill the virus. So it's absolutely okay to wash your hands with soap and water, but on those sort of occasions where you're on your way out, you're at the playground and you don't have access to soap and water, then an alcohol gel is probably a reasonable thing to have available.
But don't panic if you can't find any.
That's
because
correct.
There's still soap and water. Okay, that's important. Are there any other tips you've got around protecting your family and decreasing the risk of something nasty happening?
I think also thinking about the way in which we cough and sneeze is really important. And a lot of daycare centres and schools have educated our kids about how to do that well, and to cough or to sneeze into the elbow rather than into the hand. So by doing it into your elbow like this, I guess you're stopping your hands from being contaminated. So I think that's something that's really important, and parents can start to make sure their kids are already doing that, or they may well have the benefit of a daycare or someone else has already trained their children to do that. I know in the school setting it's strongly encouraged. So I think hand washing, the way in which we cough, and now that we know we're going into influenza season, making sure that as many people as possible who are recommended to get the influenza vaccine receive it, and it may well be that other families whose children are not on the recommended list still choose to vaccinate their kids to prevent influenza, because that will not prevent COVID-19 in your child, but it will avoid that situation where your child's got a runny nose and a cough and a fever. Which is it? What's going on? And are they safe to mingle with other people? So I think it helps for those things as well.
The flu vaccine for this year is not out yet, is it?
No.
Right.
It's likely to be available probably towards the middle of April. We don't actually have a date as yet, and so we haven't started healthcare worker or childhood vaccinations or adult vaccinations either for the flu vaccine, but it will be available pretty soon, and I think that the recommendations are likely to be vaccinate as quickly as possible. In other seasons we've deferred the influenza vaccine. I suspect this year we'll probably say vaccinate as soon as it becomes available, in order to have that extra level of protection.
Fantastic. Now, you talked about how kids are not getting that sick. They might be sources of infection. We're hearing that Japan's closing schools, other places are closing schools. I just wonder, does it make sense to close schools if the kids are actually not the main issue here?
Yeah. I think that's a tricky one that we don't have all the evidence for as yet. I can understand from a social distancing, trying to reduce the spread of a virus, that might be a strategy that's thought of. And I guess in terms of influenza spread, we know that children mix and spread influenza really rapidly in the school environment. So it makes sense from those perspectives. But knowing that very few children, as far as we know, have been infected, and that we don't have a good handle on whether they're transmitting it between children and to other people in the community, it's hard to imagine that closing schools is the best thing to be doing right now. I hope that when we get to that situation in Australia, there'll be really detailed looks at the evidence, as well as a strong, robust discussion, rather than a reaction to think that that might be the right thing to do.
Look, that was fantastic. You don't get an opportunity like that every day, to have two experts really going into a lot of the detail. We know this is a changing field, that every day we're getting new information, every day we're learning more information about this virus, and therefore the recommendations are changing. So what we're going to try and do at the Institute is be as clear as we can. We want you to keep an eye on Telescope. We'll be putting out some very clear statements about how we as an institute are going to manage coronavirus, and what it means for you as staff and students, and also for your families as well. But the other thing is, as Alan said, log on to the trusted websites, keep an eye on the particularly the government recommendations, and we need to make sure that those above all are followed. And you know what? We will get through this. It's tough right now, and I get it that it's tough for a lot of people, but we're going to do the best we can. Thanks very much, and like I say, check Telescope.